Hello, my name is Jessica Cooks. I'm a nurse practitioner student with United States University, and I will be presenting a GI SOAP note for my clinical residency and practice management course. Today, we are presented with DJ, who is a 36-year-old African-American female born January 1st, 1985, who came into the clinic alone and is a reliable historian. The chief complaint is, and I quote, "My stomach is hurting pretty bad. I had diarrhea for the past 2 days, and last night I started seeing blood in my stool." End quote. Looking at the history of the present illness, the patient reports an abrupt onset of diarrhea which started 2 days ago. The patient reports 4 to 5 liquid stools each day for the past 2 days. The patient reports the stools start off large and get smaller throughout the day with some rectal burning after going frequently. DJ reports after wiping during episodes of diarrhea, blood is observed on the tissue, but she is unable to tell if the blood was in the stool and actually in the toilet. DJ describes blood as small amounts of bright red blood. DJ reports experiencing some associated nausea that comes and goes without any treatment, but denies vomiting. DJ reports abdominal pain started 2 days ago, shortly before the diarrhea started. Describes abdominal pain as a mix of a crampy pain, more sharp right before diarrhea occurs, and a constant achy pain all over the stomach which does not radiate. She took Motrin 200 milligrams the first day the abdominal pain started, and it provided relief shortly. She reports eating and drinking less due to this abdominal pain. Her current pain is a 6 out of 10 with a constant ache to the upper and lower abdomen. The pain gets severe as a 10 out of 10 right before diarrhea occurs. DJ came in for her wellness visit in May of 2021 and was instructed on the need to lose weight. Otherwise, her physical exam and laboratory results were unremarkable. DJ denies experiencing similar symptoms in the past and denies any medical problems. Furthermore, looking at her past medical history, besides being informed she needs to lose weight because her BMI is over 30, she does not have any other medical history, chronic conditions, or past surgical or history of hospitalizations. She drinks 2 glasses of wine once a week while watching movies with her roommate, and occasionally drinks mixed alcoholic beverages when going out with friends, which is less than once a month. DJ denies the use of illicit drugs or tobacco. And just looking into the food she eats, she's not on any special diet, does not take any laxatives, and does not consume any coffee or caffeine. So this patient, we're going to move on to her objective findings, which is she's afebrile with no significant findings in the vital signs outside of a BMI of 33.6 with a height of 5 foot 4 inches and a weight of 196. The physical exam reveals abdominal tenderness bilaterally with hyperactive bowel sounds in all quadrants. Otherwise, the physical exam is unremarkable. Moving on to the assessment. Since this is a woman of childbearing age with abdominal pain, we want to rule out pregnancy. So we could do a urine pregnancy test in the office to just ensure that she is not pregnant, which is not suspected at this time. So with pelvic inflammatory disease, we would just want to rule this out because she is having some abdominal pain and possible vaginal bleeding because when she wipes, she's not sure where the blood is coming from. So we would rule this out because the pain is not specific to the pelvic area, and the pain is more severe preceding episodes of diarrhea, which is not typical of pelvic inflammatory disease. I would consider irritable bowel syndrome due to this being a female patient having more than 2 loose stools per day, although no other findings in the history and physical support irritable bowel syndrome, so we would rule that out as well. Our final diagnosis for this patient is gastroenteritis. The patient was recently exposed to an individual with an infectious disease, and gastroenteritis can be spread from contact of an infected person. The patient is symptomatic of gastroenteritis with the abrupt onset of nausea, diarrhea, and abdominal pain and tenderness. So she is, at this time, the clinical diagnosis shows that gastroenteritis is the most likely diagnosis. So we're going to move on to the plan for this patient. I want to further assess her travel history, a 24-hour diet history, and vaccination history. The patient does not present with signs and symptoms significant for dehydration, so no immediate tests are required. Although for this patient, we are going to order CBC, CMP, sedimentation rate, urinalysis, and a stool sample to check for blood and parasites. We also want to just look at the blood levels to see if there's anything abnormal, to check the kidney function. And we want to see if we can identify any causes or abnormalities caused by the diarrhea. While we are in the office, we want to educate this patient on meticulous hand washing and just make sure that we enforce the importance of washing her hands each time she toilets, anytime she eats or handles food, and especially before and after handling raw food. The primary treatment for viral gastroenteritis is fluid replacement. So with each diarrhea episode, the patient should drink a full glass of water or other fluid. The patient will be instructed to drink Gatorade, or if she prefers, she can drink Pedialyte. We just want to make sure she replaces important nutrients that may be lost with diarrhea. I would recommend this patient consumes a small, bland, low residue diet just to make sure she is tolerating just meals, and she may tolerate this diet better than other diets. I'm going to instruct this patient to get plenty of rest, and as the symptoms resolve, she can increase her physical activity. We'll teach this patient not to use anti-diarrhea medicine, as this may prolong the course of some infections. This patient will be instructed, if the symptoms do not resolve in 72 hours, to follow up, and the patient will be instructed to follow up in 1 week for a renal function panel and to repeat a CBC. That completes the plan for this patient. I encourage your feedback, and thank you, instructor and classmates, for watching. Have a good day.